Obesity is defined as having a body mass index or BMI that is calculated to be over 30. Currently, around 20% of pregnant women have BMIs over 30. If you are unsure what your BMI is, please speak to your GP, midwife, or use the NHS's free BMI calculator. In this short video, we'll explain how being obese can affect your pregnancy and birth experience, and what to expect during pregnancy, including the additional support that is available. Maintaining a healthy lifestyle and diet is important for all pregnant women, and your midwife and other healthcare professionals will support you to make decisions for a healthy pregnancy and beyond. What should I do to prepare for pregnancy? A healthy BMI range is between 18.5 and 24.9. If your BMI is above 30, then you could be at risk of complications during your pregnancy and birth. To reduce these risks, it's important to lead a healthy lifestyle that includes eating healthily, regular exercise, and not smoking. Research has shown that losing between 5 to 10% of your current weight before becoming pregnant can help to significantly reduce the chance of complications in pregnancy. If you've had a baby before, losing weight in between your pregnancies can also help to improve outcomes for you and your baby. Small changes you can make during pregnancy can include going for a walk each day and considering how many calories are in the meals that you're eating, and if you could make some healthy swaps. Folic acid is recommended to all women to keep your baby healthy during pregnancy. For women with a BMI above 30, the chance of complications for your baby is greater, and so your GP or midwife will recommend that you take an increased dose of 5 mg of folic acid 1 month before conceiving if possible, and through the first 3 months of your pregnancy. You will need a prescription for this, so make sure you discuss it with your GP or midwife. If your BMI is above 30, your GP or midwife may suggest some vitamin supplements, such as vitamin D, before conceiving if possible and during your pregnancy. If your BMI is above 50, your GP or midwife may suggest additional vitamins, and you may be offered an extra blood test and review by a specialist multidisciplinary team, including a dietitian, to give you additional support. How could my weight affect my pregnancy? Being obese can increase your chance of complications. You, your midwife, and other healthcare professionals can work together to make a personalised care plan during your pregnancy to reduce the likelihood of or manage any complications. It's important to be aware of the risks and to have a healthy diet and lifestyle, and to take any supplements or dietary advice given to you by your healthcare professionals. Women who are obese in pregnancy have an increased risk of miscarriage, stillbirth, and premature birth, as well as preeclampsia, gestational diabetes, and blood clots. You'll be recommended a test for diabetes. You may also be offered growth scans to check the growth of baby, and an appointment with an anaesthetist to discuss pain relief options, as an epidural may be more difficult to site. The risks of having a baby that is over 4 kilograms or over 8 pounds 9 ounces is greater if you are obese, and this can cause complications during your labour and birth. These include experiencing a shoulder dystocia, which is when there's difficulty in delivering your baby's shoulders, or a long labour, which may mean an emergency caesarean section is recommended. You are also more likely to bleed more after your baby is born if you are obese. Your midwife and other healthcare professionals involved in your care will support you throughout your pregnancy to lead a healthy lifestyle that will reduce the chance of or help manage any complications. What should I expect during my pregnancy? At your initial antenatal appointment, known as your booking appointment, your midwife will offer to weigh and measure you to calculate your BMI. They will also discuss your current eating and exercise habits, as well as offering you advice and support with this. They will also offer to refer you for further advice with an obstetrician, who is a doctor that specialises in supporting women with pregnancy or health complications. If your BMI is over 50, you may be referred to a dietitian for further support. It's important to know that whilst talking about your weight can be difficult, healthcare professionals are there to support you and help you to have a healthy pregnancy and baby. Healthcare professionals will undertake risk assessments for conditions like preeclampsia and blood clots, and it may be recommended that you take additional medications to reduce these risks. You'll be advised to give birth in a hospital rather than at home because of the risk of bleeding, and you may need to take more medications after your birth to reduce other risks. One common recommendation is to continue to take vitamin D if you're planning to breastfeed. To recap, around 20% of pregnant women are obese. Risks include miscarriage, gestational diabetes, blood clots, long labour, bleeding after birth, premature birth and stillbirth. You may be offered additional scans and an extra appointment with an anaesthetist. Your midwife and other healthcare professionals will support you throughout your pregnancy to lead a healthy lifestyle that will reduce the chance of or help manage any complications. Some medications will be recommended to further help reduce some risks. Your midwife and other healthcare professionals are there to support you. If you are ever worried or have any questions or concerns, contact your midwife. Thank you for watching. This is an educational video created by the Southwest Maternal Medicine Network.